Almost everyone is dealing with difficult circumstances right now as a result of COVID-19, but for those dealing with addiction, it's presenting complex challenges, including jeopardizing hard-won sobriety and recovery. David Rockne Corrigan is our Eastern Ontario Hub editor, and he joins us now from his home in Kingston, Ontario. Welcome.
Hi, JN.
Now, you've been following issues related to homelessness and addiction since the COVID-19 outbreak started to affect Ontarians. Let's start with homelessness. What are some of the challenges homeless shelters have faced up until this point?
Sure, let's start in Cobourg, Ontario, which is about an hour's drive east of Toronto. It's a town that has essentially just one emergency shelter, the Transition House. And I'm starting there because I think it's indicative of what's happening at a lot of shelters, particularly in smaller towns across the province. And when the COVID-19 crisis first hit, things were pretty shaky for this particular homeless shelter. They were running out of supplies. The food banks in town were running out of food faster than they could restock shelves. They were running out of cleaning and sanitizing supplies. And they were also, as is true of shelters right across the province, it's hard to do physical distance in a lot of these places. If you've never been to an emergency shelter, these are often big rooms, sort of open air rooms where people are often a couple of feet apart, spending most of the night within a foot or two of the next person beside them. So space was becoming an issue. It's been a couple of weeks that I've been following this now, and things have been getting better. In Cobourg, they did move over to another space, which we can get into in a moment. But space is an issue. It's really hard to do physical distancing in these shelters, and that's true right across the province. I also spoke to Salvation Army. They run about 2,000 shelter beds at 20 locations around Ontario, and they're having similar problems. The space, it's hard to do physical distancing. When you having group meals is something they can't do anymore. And they're also, there was a call from them on their food banks because as other food banks in town, looking at Toronto and Orillia in particular, as other food banks were drying up, people were coming to Salvation Army, putting further strain on the resources. And one thing I haven't touched on is the employees. Now, what happens if employees at these places get sick? At the Transition House in Cobourg, that's a worst case scenario that Ann Newman, the executive director there, doesn't even want to think about because this is not something that can close. These people would rather keep operating, even if it means bare bones operations. So things have been shaky, though they're starting to level out from the emergency state that things were in just a couple of weeks ago.
I want to pick up on a thought there about new spaces. We know that hotels and empty buildings now are being repurposed to house homeless people. Based on the people that you've been speaking to, how sustainable is this solution?
Well, in the case of Cobourg, it won't be sustainable simply because they've turned the local high school into a shelter. So, as soon as the students come back to school, well before that, they will have to arrange for new spaces. And you think about Toronto, where that city has announced that they would be opening up hundreds of hotel rooms, and they're in the process apparently of acquiring hundreds more. But this is still just a fraction. I was speaking to a community health doctor in Toronto, and she says, even with 1,000 hotel rooms, this is still just a drop in the bucket. Keep in mind that in Toronto, on any given night, there's around 8,000 people, experiencing homelessness. So these hotel rooms are a welcome addition to the shelter system at this time. But some of the folks I've spoken to says it's a little too late.
I'm curious to know what's been the government's response, especially with the COVID-19 pandemic and combination of homelessness?
Sure. So both the federal and provincial government have said that vulnerable residents are a priority. They have both shared that message, and they have put some money into this. I know the feds have put $157 million into homeless shelters, another $50 million into domestic abuse and sexual abuse shelters on and off Indigenous Reserve. And so there is money that's out there. The provincial government last week also announced roughly the same, about $150 million going towards nonprofit social service providers. Though the people I speak to, and this is an important point, is they're saying, it's unclear to them how and when that money may trickle down, because it's right now that they're facing an urgent need for resources.
Now, many people experiencing homelessness are also dealing with alcohol or drug addiction. What do they do when they're unable to do these in-person support meetings like AA? Like many of them, they're in isolation just like you and I. So what are the options there?
Sure, and you raise an important point. I think it's important for all of us to pause and reflect on the fact that many of these spaces that have been shut down because of the public health crisis. You think of public libraries, you think of park benches, you think of programs that are offered in our cities. A lot of these places are shut down. Where is someone experiencing homelessness to go? I was speaking to the community health doctor at Parkdale Queen West Community Health Center in Toronto, and she says people have been reaching out to her saying that they haven't even been able to go to the bathroom in days. They don't have a place to go to the bathroom. So it's a real issue. These programs, these services that the people rely on experiencing homelessness, particularly those with substance use disorders. So yes, where does someone go when their AA meetings, their in-person Alcoholics Anonymous meetings, or their NA meetings have been canceled? Some of these things have gone online. But as another issue for a lot of people experiencing homelessness, they don't have phones, they don't have the technology, they don't have the ability to go online, to use a phone, to connect with these online, these health services that may be available to them. They just don't have the means.
I know you were talking to some treatment centers, and they told you, if anything, during this outbreak, they've been busier than ever, correct?
Yes, I think that there's a sense that there's a chain reaction pushing as services close, as there are fewer in-person meetings and opportunities for people seeking treatment to get that routine, that treatment that they have been seeking, that there has been a bit of a strain. So one program in particular, this is a safe opioid supply program in Toronto, that would typically be getting a couple of calls a week, is now getting calls multiple times a day, and this is because as we push our people experiencing homelessness, as we push those people into hotel rooms, it's great getting them off the street, but at the same time, how are they going to be able to get their daily, what is essentially a daily need for what may be illicit drugs? So having them in the hotels is one part, but then how do we prevent them from getting sick by perhaps using bad drugs? How do we keep them in the hotel rooms? And one solution here is expanding safe opioid supply programs.
Let's pick up on that. In your latest article, you talk about safe supply programs. What's so important about them?
Well, what it does, and at a time like this where society, things are not business as usual, this even would be impacting low-level drug dealers. So the illicit drug supply is thought to would potentially be getting worse over the next coming weeks, and that will drive people into hospital rooms. And so doctors don't want to see this. They would like to see doctors given the ability to prescribe safe baseline dosage so people don't get sick, and so they can fulfill those needs that they have for different substances.
Now, not all people who are addicted to alcohol or drugs are on the street. What have you learned about people who are dealing with these issues, who are at home?
Sure. So, Jan, there are thousands, if not hundreds of thousands of Ontarians who struggle with substance use disorders that aren't street-based, that do this from the privacy of their home. And as we all know, this time when we're isolating, some of us are really truly alone at this time. And I've spoken to some experts who say that this can be a very vulnerable place to be. You've got uncontrollable events. You've got a break in routine. In some cases, in many cases, if you're already on the recovery process, some of the treatment programs or services that you take advantage of may have stopped. So this can be seen as a very vulnerable time for people dealing with substance use disorders, especially because being with oneself can often be difficult for people.
Now, keeping the LCBO open and beer stores has been a pretty heavy debate online. The Ontario government, of course, opted to keep the stores open, deeming them essential services. Why is that important when we talk about addiction?
Sure, and this is something that Premier Doug Ford alluded to last week. I think it was last week. The days are sort of flying by. Doug Ford alluded to this when he said, people wonder why the LCBO has been considered an essential service, and it is precisely because some of the folks in our society that do have substance use disorders and that would put an extra strain on the healthcare system if we were suddenly treating thousands for alcohol withdrawal symptoms. I spoke to a paramedic who says that this is a much more serious public health issue than I think a lot of us realize, which is if the LCBOs were to be closed, the folks who need that alcohol on a daily basis would get sick, and it can lead to some serious health consequences. So for now, the LCBO will remain open. Doug Ford has said that the list of essential services is sort of a work in progress, if you will. So it's possible we may see a time when the LCBO is removed from that list, but I don't think we'll see a time when alcohol is unavailable in Ontario. I think that we may see a move towards more online delivery. There may be an opportunity here for the LCBO to weigh the needs of folks with substance use disorders and the ability to keep that open to them, but also, of course, their employees. And I spoke to an employee. This is how my interest in this story arrived, as someone approached TVO, an employee at an LCBO, saying that they were unsure that it was safe for them to be going to work with business as usual in this sort of retail operational setting that the LCBO has. So it's balancing, surely, the needs of the employers versus the public health risk that would come if we were to go completely dry here in Ontario.
I think I have about 30 seconds left, and I want to ask you, maybe ending on a little hope here. Is there anywhere people can find hope in this otherwise difficult time?
It's really difficult. This is something I've been talking to people for the last couple of weeks, and I can hear in their voices the struggle, the difficulties, the challenges they're facing. But at the same time, I hear the compassion, and I hear the passion for their work, and the understanding, the realization of how important it is, and how some of Ontario's most vulnerable people feel like they're being left behind. So I see hope in people coming together to work to try to help Ontario's homeless population, people in Ontario with substance use disorders, people that are on the street right now. There are people that are looking out for those folks, and so I also just will mention that food banks, local emergency shelters need our help. Go to salvationarmy.ca, go to Food Banks Canada, Feed Ontario, Google your local food bank. These places need our help. That's where they're seeing the hope too, is they're seeing communities come together to help people in need at a time when a lot of services, a lot of the routine, the things that folks are used to are just not there.
David, I want to thank you for bringing some in-depth coverage from Eastern Ontario. Thank you again so much. Really appreciate it. That's David Rockne Corrigan, our Eastern Ontario Hub journalist.
Thanks, Jan.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.